Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, the message for today is on the debate whether hydrochlorothiazide is better or whether chlorthalidone is better for the treatment of hypertension. For a long period of time, there has always been a debate which is a better diuretic to choose for the treatment of hypertension, either hydrochlorothiazide or chlorthalidone. There were a number of trials done with hydrochlorothiazide and chlorthalidone, and various meta-analyses have suggested that chlorthalidone appears to be superior to hydrochlorothiazide. However, most recently, a major trial called Diuretics Comparison Project. Diuretics Comparison Project has compared hydrochlorothiazide with chlorthalidone head to head. This is the only trial that has compared head to head hydrochlorothiazide versus chlorthalidone for the treatment of hypertension, and the trial was completed. In this trial, Diuretics Comparison Project, the benefit that was provided by hydrochlorothiazide and chlorthalidone was very similar in general, but the chlorthalidone dosage was half the dosage of that of hydrochlorothiazide. So one conclusion was chlorthalidone at low doses provided good protection as much as a high doses of hydrochlorothiazide. However, in patients with pre-existing cardiovascular disease, namely patients who may have prior cardiovascular disease, which is many patients with hypertension, chlorthalidone was very superior to hydrochlorothiazide. In patients with pre-existing cardiovascular disease, chlorthalidone reduced the morbidity and mortality much more compared to hydrochlorothiazide, reduced cardiovascular complications much more than hydrochlorothiazide. The clinical outcomes were much superior with chlorthalidone compared to hydrochlorothiazide. So when you look at the totality of this diuretic comparison project, chlorthalidone has been suggested as a superior choice over hydrochlorothiazide, not only to control hypertension, but to prevent cardiovascular complications of hypertension. And low dose chlorthalidone is available in our country. And more recently, US Food and Drug Administration has also approved the use of low dose chlorthalidone for the treatment of hypertension. So, in summary, when you look at the totality of the evidence, including the diuretics comparison project, chlorthalidone has been shown to have many advantages over hydrochlorothiazide for the treatment of hypertension.